following video is the opinion of Danton S. Dungy, MD. It is not medical advice. It is the tool that he is providing for his current and future patients. It is meant to serve as a review of the common concerns brought to Dr. Dungy's attention over the years. This video is not designed to diagnose, cure, or recommend treatment for any medical problem, nor is the video all-inclusive of the medical opinions of other surgeons. Equally, the opinion expressed in this video may not be relevant to your specific condition. Dr. Dungy is giving a general overview and would recommend that you schedule an appointment if you would like further information. For additional contact information, visit his website at dungymd.com.
Hello, Dr. Dungy here from the Dungy Orthopedic Center. This video short is about the treatment options available for knee arthritis. Many patients have knee pain that is caused by arthritis. As an orthopedic surgeon, I am one of several thousand who perform knee replacement surgeries. Recent statistics from the American Academy of Orthopedic Surgeons revealed that there are over 600,000 knee replacements performed annually in this country alone. However, there are many treatment options that are available to you as a patient prior to even considering surgery. The first thing my patients usually ask me is, what can I do to help with this new diagnosis of knee arthritis? The pain is severe sometimes and I want to feel better. Well, the first thing I recommend is to avoid the activities that hurt. If you're a runner or enjoy other impact activities, then you have to decrease these activities and consider cross-training. Swimming and bicycling have been shown to decrease the symptoms associated with arthritis because of less impact across the arthritic joint. At the same time, we look at the patient's weight. If we find that you are overweight or even obese, we need to work on weight loss. By decreasing the weight across your arthritic joint, your symptoms can be decreased considerably. Now, many patients tell me, Dr. Dungy, I cannot exercise because my knee hurts, therefore I can't lose weight. The reality is that weight loss has more to do with decreasing caloric intake and watching what you eat more than being able to exercise. Now, exercise is important. As an orthopedic surgeon, I really support being active. I like the concept of you having stronger muscles, increased bone density, and improving heart and lung health overall. But the reality is, watching what you eat is most important. After weight loss, another way to take pressure off of your painful arthritic knee would be to consider using an assistive device. This includes canes, walkers, or crutches. Now, many of my patients say, there's no way that I'm using that. I'm way too vain. I won't be seen with one of those. But the reality is, if you have sharp pains and they are very unpredictable and unexpected, you could potentially have a fall. And the last thing I would want to do is get a call from one of my patients that they're in the emergency room with a broken hip or a broken wrist because they fell. Next would be the treatment option of medication. Over-the-counter medications are useful to help with these symptoms associated with knee arthritis. The first thing we usually recommend is Tylenol. It has a very safe profile overall. More than 3,000 milligrams a day, however, could cause liver injury, so you have to watch how much you take. If Tylenol is not working for you, then a potent anti-inflammatory such as ibuprofen, brand name Motrin or Advil, or even over-the-counter Aleve can be another helpful anti-inflammatory. They can decrease the swelling and your overall symptoms associated with your arthritis. The good thing about these medicines is if you have arthritis in more than one spot, it can help most of these things at the same time. The downside about them is they have been shown to have some severe serious side effects. These include long-term use causing some kidney damage or even gastric ulcers or stomach ulcers, which can lead to bleeding and blood loss. This is rare, but it can happen. If you find that you get an upset stomach when you take this, even after taking it after meals, you should consider discontinuing it. At the same time, if these medications do not work, there are other medications such as non-medication food supplements. These include chondroitin sulfate, glucosamine, MSM, and other things you can find in your local stores that are in liquid form and pill form. These different substances are supported by the American Academy of Orthopedic Surgeons as being a possible reliever of symptoms of knee arthritis. However, we recommend trying them for a month or two, and if you do not notice any difference, the recommendation is to discontinue them. But if you notice improvement in your symptoms, then continue them. If these easily obtainable medications do not work for you, you may need to visit your physician. Your surgeon or primary care doctor can provide you with a prescription for a prescription strength anti-inflammatory. There are about 15 of these on the market, and one may be just right for you. If medication does not work, then the next thing to consider would be bracing. By wearing a brace, you can decrease the swelling in your knee and also stabilize your knee. Some patients find this very helpful, especially if they know they're going to increase their activity level. They may choose to wear it during those situations. The next option would be physical therapy. By strengthening the muscles around your knee, you may find an increase in strength and endurance, and these muscles actually can help bear the weight about your knee joint more so than the bones and joints themselves. If physical therapy does not work, some home exercises, including bicycling, seem to help many patients feel better. The increased motion while decreased weight across the joint helps recycle the lubrication within your knee, which removes the inflammatory toxins and provides the nutrients for the remaining cartilage. If exercise is not helping you, then we have to consider more invasive treatment. This includes injection therapy. Anti-inflammatory injection medication is cortisone. Most patients have heard of cortisone. It is a potent anti-inflammatory very similar to putting Motrin or Advil directly into your knee where you need it. Unfortunately, the results vary from patient to patient. Some patients get excellent relief for several months or a year, and others it lasts for a few weeks or a few days, and in some it does not work at all. If on x-ray your bone is touching on bone, the chances of it working is at best 50%. The other type of injection available is a lubrication shot. Surgeons and physicians call it viscosupplementation or hyaluronic acid therapy. Patients sometimes refer to it as lubrication shots, oil shots, or chicken shots. They call them chicken shots because the first medication that came on the market over 15 years ago is made from rooster combs. It is the #1 selling lubrication shot on the market. They sterilize the stuff inside of rooster combs, which has the same juice that is found in our knee. As we get older and develop arthritis, the knee fluid that our cells makes becomes more watery and does not do a good job as a lubricant. So, by injecting into your knee a more thick lubricant, it helps glide better over the rough spots. Understand, this does not help rebuild your cartilage. If none of these treatment options are available for you or do not work for you, some patients do benefit from arthroscopic surgery. However, if you have advanced arthritis, this typically will not help improve your situation for more than 30 days. Thus, it is usually not recommended. The last option would be surgical intervention for joint replacement. Whether a partial or full knee replacement is needed, it is something you should discuss with your surgeon. If your surgeon believes your x-rays are bad enough, and you believe your symptoms are bad enough, and you have been unsuccessful at relieving symptoms with some of the outlined treatment modalities, then maybe it is time for you to consider surgery. Be sure to visit my website for additional videos and information at dungymd.com.